edema due to inflammation, edema due to lack of muscle contraction. Okay? So here are the mechanisms for the wound healing. Okay? They're activating cells by altering cell membrane function. You guys can read through those. I want you just to have an idea of what that mechanism does in the body, the reaction, right? Parameters. So the wavelength or wave type that we use for wound healing is called high voltage pulsed current. High voltage pulse current. HVPC is for wound healing. Monophasic high voltage pulse current. So monophasic means what? Going in one direction, right? It's not alternating. One, and those peaks, probably not the most comfortable wavelength, right? It's an actual peak instead of just like a roll, those rolling hills, the swiping, or what they call swiffing, or so know that HVPC is for wound healing. That's what you use it for, okay? Here are some pictures of, you're not putting it on the wound, right? So we're putting the electrode in the two between, right? So that you can get that current on each side. This one is on the wound. But what do you notice that's under that electrode?
A burn? Is that a burn? I can't tell.
Huh?
Is that a burn?
No, that's where the wound is.
Oh.
The wound's under here. And they did put an electrode on top of the wound. But what's under the electrode? A gauze. Right? A gauze. You ever done that, Julie? I mean, yeah. You're only gonna do this if you're actually working in a wound clinic. Okay? They will usually do this, or in an outpatient type of wound clinic. Unless you're working with wounds. So some hospitals, all the wounds are taken care of by nursing. There's no, right? For example, Presbyterian though does have one PT who's a wound specialist that works alongside with nursing, right? But it's one PT. There's no assistants involved. At UNMH, they have a whole wound clinic. They have PTs that do all the evaluations, but I'm going to tell you, the assistants run the clinic. All the treatments after the evaluation come in, the assistants are running that clinic in terms of providing the treatment. Okay? Knowing enough to go back to the PT and say, this wound's not healing, this wound is healing. Can we change the treatment? Okay? In the summer, in your summer course, we have 2 PTs that used to work at, I think one's still works there, one's retired at the UNM wound clinic, and they actually go through the whole process of teaching you about wounds and having you do some hands-on. The other thing I was going to say about wounds, so just like with joint mobilization, you are licensed to do grade 1 and 2. For wound healing, you are not licensed to do deep, sharp debridement. So what does that mean? That means you cannot use a scalpel to cut away tissue. But you can do debridement with, to some degree. Okay. So you are not licensed to do sharp debridement. It means you can't use scissors to cut away tissue. Okay. That's the scope of your practice for us. Again, you can read this in your book. It talks about a negative polarity and positive polarity in terms of negative early inflammation, positive later to facilitate epithelialization. So, what's the polarity of your settings? Okay. Again, here it tells you the parameters. I don't necessarily want you to memorize that, but know what it's for. Yes.
So for this version of it, does the truck, basically which electrode you use actually does matter? Like for which place, like where you place it?
I think it's more of the settings. Yeah. And I'll let you read it in the book. All right, edema control. Do not treat edema with systemic causes, as we were talking. So heart failure, liver failure, or kidney failure, they all these conditions create a lot of edema in the limbs, right, or in the body. We're not getting rid of that edema with electrical stimulation. Only caused by inflammation or lack of motion, right? You have an issue with your knee, right? You strained it, or ankle, you sprained your ankle, something like that, we can work on that inflammation. And of course, if it's inflamed, you're not getting movement, right? So, but the area is not hot or red or swollen. Negative polarity HVPC retards formation of acute edema. Okay? So roughly 50% reduction, similar to the magnitude of ibuprofen or cold water immersion. So it has the same effects as those two other treatments. Negative charges repel negatively charged serum protein, so it pushes them away from that area. So you have to make sure the area is not cold, pale, or swollen. Again, which is, you're like, well, it's swollen, and that's what we're using it for, right? But again, excess swelling then becomes systemic, right? Healthy muscles contract to promote fluid return from periphery without contraction. Edema accumulates. Treat with motor levels, electrical steam, and elevation, followed by compression garments. So when you're treating somebody for edema, you have to make sure you elevate that limb when you're treating them, right? Just like if you're treating edema with ice, you want to elevate, and then you want to compress, right? Those ice. Settings. So waveform, electrode placement. So again, these are just settings for that edema due to inflammation. Know that you need to use that negative polarity to decrease the edema. That's the extent of what I need you to know, okay? Just an example, again, so you have a positive here and a negative to retard edema formation. So the negative, seems like the negative is at the inflammation site. Because then you want it to go to the positive, right? I've never done this in clinic. Again, I was mainly an acute therapist. We don't really do electrical stim. In outpatient, you have more outpatient experience. You ever did this in outpatient?
I don't have much experience, but I've done this.
Well, who was the patient?
A younger age. You know, not real often. We mostly did the stem on backs.
Yeah. So again, it's there. How often? It depends on the clinic, what they like to use, okay? Again, I think we've moved away from solely using modalities to fix the problem and say, I'm gonna do this, but then I need you to actually move your muscle, right? Actually get that fluid out naturally. And then here's the parameters for that. I don't expect you to memorize those in terms of for the edema. again, it's actually having you do a muscle contraction, right, to try and get that swelling out. But, again, wouldn't we want the patient to just be able to do it on their own, right? All right, iontophoresis is the next modality that we're gonna use. So uses low amplitude direct current to facilitate transdermal drug delivery. So they're based on the principle that light charges repel. So most commonly used in rehab to apply dexamethasone. This is the most common anti-inflammatory corticosteroid use. Most common anti-inflammatory corticosteroid use. So let me repeat that again. Okay? Drug penetrates a few millimeters. So, because it's direct current, it's not comfortable at all. Right? It's very pokey. So, a common iontophoresis treatment is 10 minutes. But at the 10-minute, if you want it to penetrate in 10 minutes, you have to put the amplitude at 4, which is painful, not very comfortable. Your patient says, that feels uncomfortable. Say, sure, I can turn it down, but you're gonna sit here for 40 minutes. Right? So if you can tolerate this for just 10 minutes, we'll be done sooner. Right? So you always need to encourage them to be done in 10 minutes. It doesn't feel very comfortable. Nowadays, we have this. Push a button, you put it on the patient, you push the button, and you let them go home. It's gonna deliver that drug throughout the day. Yes, the drug must be prescribed by the physician for the PT to be able to administer it. Right, you have to draw it out, and I'll show you how we do it the old-fashioned way. But now these machines are preset. The drug is already in there. You need a prescription for this. The PT, or you put it on, turn it on, and they go home. That's it. So again, this is one of those modalities where you're not gonna sit there with them, okay? Yeah, it just has to be.
How long does it take to fully administer that
I'm not really sure, but it can take all day. Do you know? Yeah.
We've only used the old fashioned.
Yeah, the old-fashioned way.
Just tell them that it's just gonna take the entire day to.
Yeah.
I mean, that one says 24 hours.
Yeah, 24-hour iontophoresis patch, 24. So, again, right, that's a new way, and it's one-time use, you just, I'm thinking that little thing is what comes off of the patch, and you can attach it, and maybe has a cartridge with the medication in there. So electric placement and size. So the old-fashioned way, you have the active electrode and a ground. And we'll see that, okay? So the polarity, same as the active ion in the drug. So it depends. If your drug has a negative polarity, then you have to drag it in with a positive polarity, right? And then if your drug is a positive polarity, you have to use the negative polarity to drive it in. Old-fashioned. The new way is to push the button. You have to think about it. All right, so here is a list of drugs, which is your ion, and then the polarity, and then these are the indications. So for example, the dexamethasone, which is what we use, has a negative polarity. It's for inflammation. And then this is the percentage of the concentration. So you don't need to memorize the polarity of these drugs. You have that cheat sheet right there, right? for as much as you're ever gonna do this. Again, you have the machine now, you just push the button. But if you have to do it the old-fashioned way, this is your cheat sheet. And I'm sure every clinic has a cheat sheet if they ever use it often. Okay? So which drug is the most commonly used? Okay, dexamethasone, phosphate. Again, lidocaine is for local anesthesia, magnesium, muscle relaxant, vasodilator. Again, dexamethasone is the most, lidocaine, you want it to just kind of numb. They have topical things now. You
Is
need
it,
to
is
drive
it
the thing.
topical more common?
For us, I don't know when we would use lidocaine. When would we use lidocaine? Right, I mean, the only thing I can think of is the vasocoolant sprays. You know, they do kind of numb you just because they're so cold before they stretch you, but other than that, I mean, when would we use it? Right? Before I had my knee surgery, they were trying all sorts of stuff, and they would do the vasocoolant spray here before they put in that big old needle in there. It's gotta be big, right, to go into the joint space? But, I mean, when else would we use lidocaine? Not any other time, okay?
What is hyperhidrosis?
Mm-hmm.
Use tap water?
Is that what it says?
Does it have
You drive in water in there.
possible?
It's different when you wash with water than when you drive it into your skin, right? Right? All right, that's it. So I want you to know, let's go, because what I want you to know I'm gonna show you the Ionto we have. We're not gonna do skill check on that, just because we have the new little machine that you're gonna use out in clinic. So, to recap, understand the mechanisms that are under, for currents, for tissue healing that are there. Does it help the wounds, right? How does it help edema control, the mechanism for that, and then transdermal drug delivery, what you are doing here for iontophoresis. That's it for this, okay? Let's get that ionto